Good afternoon, everyone, and thank you for joining us today for a roundtable with women from the Maine legislature to discuss Trump's broken promises to women over the course of his presidency. My name is Kathleen Marra. I'm the chair of the Maine Democratic Party, and I'm very excited to have joining us today for this roundtable State Senator Cathy Breen of Cumberland and State Representative Lois Reckitt of South Portland. Senator Cathy Breen is serving her third term in the Maine Senate, where she chairs the Appropriations and Financial Affairs Committee. Senator Breen has been a champion for women, children, and families in the legislature. Among her many accomplishments, she passed a law to reduce early childhood suspension and expulsion rates that was signed into law by Governor Mills, and passed a bill to promote pay equality by discouraging employers to base wages on salary history. Representative Lois Reckitt is a particular hero of mine. She submitted the LD 433 resolution to pass the ERA, finally, and I believe that's still under consideration. She's serving her second term in the Maine House of Representatives, and she's made a significant mark in her 2 terms. She's a member of the Maine Women's Hall of Fame, a longtime advocate for Maine women and families. Before retiring, Representative Reckitt spent 36 years as an executive director of Family Crisis Services for Cumberland County. Under her leadership, the organization became a leader in domestic violence services and prevention. She's led the charge to pass a constitutional ban on sex-based discrimination, efforts that have been thwarted by the Republicans in the legislature. Please join me in welcoming Senator Cathy Breen and Representative Lois Reckitt. It's no secret that Donald Trump's presidency has been a disaster for women. We could spend a full hour just discussing his misogyny and absolute contempt for women that we've seen in public. We heard the tape from that truck that was just so horrifically misogynistic. And we've seen in his public appearances, and we've seen them in his tweets. But what we really want to focus on today is Trump's appalling record on policy with women. Before he entered office, Trump repeatedly promised that he would do more for women than anybody else. And he would look out for their reproductive health and their personal safety. Over the course of the last 3.5 years, Trump has repeatedly broken that promise. His policies on healthcare, reproductive rights, workplace issues, and sexual assault are a disaster for women. In stark contrast to Donald Trump's failure with women, Joe Biden, just this week, released a bold plan to ease the financial burden of care that families are carrying, to elevate the compensation, benefits, training, and education opportunities for the certification and dignity of caregiving workers and educators. Caregivers and early childhood educators who are disproportionately women of color have been underpaid, unseen, and undervalued for too long. Joe's plan ensures access to high-quality, affordable childcare and offers universal preschool to 3- and 4-year-olds through greater investment, expanded tax credits, and sliding scale subsidies. His plan also treats caregivers and early childhood educators with respect and dignity, giving them the pay and the benefits they deserve, training and career ladders to higher paying jobs, the choice to join a union and bargain collectively, and other fundamental work-related rights and protections. Joe Biden doesn't make empty promises about doing more to help women. He takes action. When we restore the soul of the nation to the White House with President Joe Biden, you can rest assured that he'll do everything in his power to address issues important to Maine women and women across the country. I want to talk more about some of the specific ways that Trump has broken promises to women over the course of his presidency with these 2 incredible women who are with us today, Senator Breen and Representative Reckitt. As we all know, especially when our president has as much contempt for women and has failed women on every issue, from healthcare and reproductive health to workplace issues and policies surrounding sexual assault and harassment, your work on the state and local levels becomes even more important in protecting Maine women. I'd like to start by having each introduce yourselves to our viewers today and tell us a little bit more about the work each of you are doing or have done throughout your careers in the State House to support Maine women. So now I'll hand it over to Senator Cathy Breen.
Kathleen, thank you so much. My name is Cathy Breen, and I serve in the Maine State Senate. I represent the communities of Falmouth, Cumberland, Yarmouth, Gray, half of the city of Westbrook, Chebeague Island, and Long Island in the Maine Senate. I'm serving in my third term, and I'll be on the ballot again in November. As Kathleen mentioned, I am the Senate chair of the Appropriations Committee. So in that role, I work very, very closely tracking and working on the state's finances. And we are probably one of the most bipartisan committees in the legislature because we always have to pass a budget by 2/3 majority. So we have to do a lot of negotiating and reaching across the aisle. So I'm really pleased to be here. I understand that there's a rally happening later today, Women for Trump, and we're here to talk a little bit about how President Trump has disappointed women in Maine and across the country. And I'm reminded of an old Shakespeare quote, how has Trump disappointed women? Let me count the ways. I mean, we really could be here all afternoon, but just on very simple things like healthcare. Because of the work of my committee, we finally funded expansion of Medicaid in Maine. There's now about 70,000 more Mainers, low-income Mainers, who are eligible for healthcare under the Affordable Care Act. And that is something that President Trump has threatened over and over and over again, and has said he's determined to repeal the Affordable Care Act, which also, by the way, gives people protections for pre-existing conditions, like if they have a history of cancer, if they have heart disease, any of those chronic illnesses that many women have. President Trump is looking to repeal the Affordable Care Act. And that means that the state, fortunately, the first thing that we passed, LD1, in the beginning of this legislative session in 2019, the very first bill we passed was to make sure that all of the protections in the Affordable Care Act are now in Maine statute. So even if he repeals the Affordable Care Act, women in Maine will be protected because of the actions of Democrats in Augusta. So I also want to talk very candidly about the immediate threat that our community and every community in the United States is enduring right now because of the president's complete and utter dereliction of duty on COVID-19. I can tell you that I met with Dr. Shaw back in January. Dr. Shaw, as we know, is the head of the Maine CDC. Dr. Shaw, back in January, had this situation in Asia on his radar. So if folks in Maine knew about it in January, I assure you, folks in Washington knew about it in January. And rather than enlist and use all the tools that the president has at his disposal, he has absolutely put his head in the sand, and that has had a disproportionate effect on women and women in Maine. As we know, women are the vast majority of direct care workers, especially women of color. So we have women working in nursing homes, in congregate homes, in group homes, in hospitals, all over Maine. Those women are putting themselves at risk, they're putting their families at risk, their communities at risk. That's because of a failure of the federal government to do what it needs to do to contain a pandemic, like we did with SARS and MERS in recent years. In addition, you look at what's happening in education. Who's the vast majority of people who run schools, who take care of our kids, who teach our kids, who are a key part of our families and communities in public education? Again, the vast majority are women. Those people have been heroic in the last several months, delivering education and interacting with their students and students' families every day through teleeducation and internet and all that stuff. Those people have had to rise to the occasion and rise to this challenge, and they have heroically. They are also now the front line for opening schools again. As we know, Governor Mills last week announced guidelines and we allocated $165 million of federal funding to schools so that they could begin the very deliberate and careful process of reopening. And that's going to be crucial to keeping women in Maine safe. Lastly, on the point of the COVID situation, of course, is the huge problem with childcare. Maine had a childcare crisis before COVID-19. And now, of course, we've had to close thousands of childcare providers across the state. Again, those businesses are run disproportionately by women. And of course, when we don't have childcare, those obligations fall disproportionately on women, especially when everybody's home and many, many women are trying to do their jobs and take care of their kids and run the household all at the same time. It's enormously stressful. And as we know, it falls disproportionately on women in Maine. Lastly, before I turn it back to Kathleen, I just want to talk about women and reproductive health. It's no secret that the president has walked hand in hand with Mitch McConnell and the Senate's Republicans in nominating and confirming judges that have we all have very little faith that if Roe versus Wade comes to the Supreme Court, that they will in fact protect it. Again, we've had to take measures in Maine, which we did in this session because we have a Democratic majority in the House and Senate. We have a Democratic governor. So last session, or during this session, we actually passed 6 bills protecting or expanding women's access to reproductive health care, including ending the discrimination that the state of Maine was using against low-income women in not covering their abortions if they were on Maine care. So we ended that discriminatory practice, and we have fought back with all the federal attacks on access and on reproductive rights. The last one that we are grappling with, and it's a bill that's still pending, as many folks know, President Trump enacted a gag rule for organizations, healthcare organizations that are funded through Title X. Title X funding explicitly prohibits that money being used for abortion care. It is absolutely not used for abortion care. It is, however, used for birth control, for cancer screening, for breast exams, for cervical cancer, for immunizations, for many, many basic healthcare functions where the family planning clinic that a woman or a family goes to also gets a lot of their primary care. If a client in one of those healthcare facilities wants to talk about abortion as an option, the gag rule means that that healthcare provider has the arm of the federal government coming in to the exam room and gagging that healthcare provider from giving honest, accurate, thorough medical information to that patient. That is so wrong. That is so fundamentally anti-healthcare, anti-privacy, anti-female. And so we have a bill that is going to propose to use state funds to replace that Title X federal funding. And when I testified in favor of that bill, I was very honest. When I was a younger woman and I did not have health insurance, I relied on Title X. I was a client at Planned Parenthood when I was in high school and college. I wouldn't have a college degree and a master's degree and be a state senator if it weren't for Title X money. This isn't somebody else out there. This is me. This isn't just my daughter. This is me and my life trajectory. And my life trajectory is where it is because I had Title X healthcare services available to me at a time in my life where I needed them. So Democrats are very committed to funding this bill, and hopefully we will get back into session. We will close the loop on that and move forward so that family planning clinics all over Maine can provide the basic and necessary healthcare that they do for so many women in our communities. So that's just the beginning, Kathleen, but I'm going to stop there because I know Representative Reckitt is here to join us as well. Back to you, Kathleen.
Thank you, Senator Breen. And I just want to say too, there are millions of women like me who are small business owners. And you know, when you own a small business, you make sure that all your bills are paid, your employees are paid, everything else comes first. And then lastly, you may take a draw from that business. And under Trump's plan, then people who own these small businesses and do not take an income were not allowed any kind of relief from the COVID pandemic, and really we're kind of out in the cold, while Trump gave his friends who own big businesses, you know, millions of dollars of funds. So I think, you know, there's that as well. And Trump's family leave proposal really doesn't offer what's been considered paid family leave. Even after the outbreak of the pandemic, his administration scaled back paid leave requirements for employers. So that allowed many companies to decline to provide sick leave or childcare. And you understand that women are disproportionately impacted by those kinds of measures, you know, and have had to leave the labor market or quit their jobs to care for their families. So anyway, I want to thank you, Senator Breen, and welcome Representative Lois Reckitt.
Hi, thank you so much. You know, I was listening to you in the beginning, and as you talked about Trump's desire to do things for women, I would contend he did things to women the minute he got into office, and all of them were bad. I think one of the things we don't pay enough attention to is the destruction and damage that he has done through his appointments process. We may pay attention to the 150 ultra-conservative judges that he has managed to appoint in his 3.5 years, but we don't necessarily pay as close attention to the people he has appointed as commissioners of various departments of government, both at the top, repeatedly in some cases. And the reality is he picks people who either don't know anything about the department they're supposed to run, or they know way too much and they're in the total wrong direction for people. So I think it's important. The other thing I just have to mention, because it was such a sort of a life transforming experience for me, which is kind of ironic since I've spent so much of my life as a volunteer trying to get government to do what I wanted it to do, until I finally retired and then became government. But was basically, I was part of the delegation that went to Washington, D.C. After Trump appointed Brett Kavanaugh to try to talk to Susan Collins about that appointment. And the 16 of us who were all elected officials from Maine, state senators, my own state senator, representatives, mayors, school board members, a whole array of people. And she wouldn't talk to us. She sent a low-level staff person to talk to us. These were 14 to 16 women, all of whom had sexual assault or reproductive catastrophe issues to talk with her about. She didn't want to hear anything of it. It was really a very disappointing and exhausting day because we flew down and flew back in the same day. So the whole issue of appointments, I think it goes across the board of the issues. I myself spent the vast majority of my life working in the area of domestic violence services. I'm actually a marine biologist by education, which most people don't know about me, but so I'm fascinating at the beach, but I haven't really worked in that field for a long time. But I was involved in the beginning and the outgrowth and the expansion of domestic violence services in the state. And that really is sort of where my heart remains. And one of the things I did in the legislature when I first came in and continue to do is to try to find the spots where there needs to be a little more tweaking to make our domestic violence laws, which are already pretty good, to have them be even better. And sometimes it's a fight, but we manage it. And mostly I was happy that when I arrived in the legislature almost 4 years ago, that people paid attention when I talked about domestic violence because they knew I had spent 36 years working in that field. So that's been gratifying to me. I want to talk a little bit more about it feels like deja vu all over again, as they say. When I began my career in the women's movement in 1971, we were working on reproductive rights. We were trying to work on the Equal Rights Amendment. We were working on Title IX, all of those things that are now either not gone through yet or which are in danger. Title IX being one of them, the bill that provides protection in the schools, particularly in the university systems for women and girls. And I was around back in the day when we had the big fights with the football coaches about how football was going to be ruined because we were going to give all the women money to the women. Unfortunately, that didn't happen. I lead you to think about which, unfortunately, that is. But in any case, that's still a problem now because of the impact that Title IX has had, which has been good by and large. But the current commissioner of education in Washington, not only does she not like public schools, which is, I mean, how you could appoint somebody to head the Department of Education who is against public schooling, I can't even fathom. But Commissioner DeVos has really been trying to weaken Title IX, which has been a stalwart for women for a long time in the school systems. So that's a really a piece that really bothers me. The other is that this whole I don't know how to describe this whole cabal of people that are around Trump, but what they do is as they in their drive to sort of cripple government in a way, or at least cripple its impact or positive impact for people, they keep changing regulations, small things it seems, that turn out to be big. Things about narrowing the harassment definition for university students. That sounds like, oh, well, big deal. It is a big deal because if the definition changes, then it may be that students cannot get the appropriate services. One of the things I just found out today was one of the changes they made is now if you file a sexual assault claim on campus, that you're required to have a hearing where the person you've accused can cross-examine you. That is crazy. All of those kinds of small things that seem small, but they are really huge. So I think it's really the whole other issue, of course. I don't know why we would ever think we could depend on a Trump administration to do anything the least bit good around sexual harassment regulations. Since he is the sexual harasser extraordinaire in this country, we all saw it with our own eyes before the election. So I think that it's really important that we remember that sexual harassment does not necessarily have to be as blatant as what we saw during the campaign. It can be a small thing constantly that happens that takes women in the workplace who are trying to do their job like everybody else and just makes it harder and harder for them to do it. Not only do they get paid less, but they get harassed on the job. So I think it's really important that we pay attention to sexual harassment in this era. Cathy Breen talked about a lot of things that I also care a lot about. I was thinking the other day about how ironic it is that, we still have not tackled the childcare issue in this country to any degree of good. We just had an occasion where, because of the pandemic, we had our daughter and 3 grandchildren living with us for 4 months. And I watched our daughter try to homeschool those children in the midst of this pandemic. And now they're all going back to school, maybe. And she's going back to teaching, maybe. And who's going to take care of the kids if they run on a 2-day-a-week schedule? It's terrible. So, we really haven't solved those things that really should be basic human rights, both for women and for the kids and for the fathers who also care about the upbringing and the health of their children. So you name an issue, Trump did the wrong thing. That you can guarantee. I can't think of one where he did the right thing. So if you can think of one, feel free to tell me. I'll call it a day there.
Thanks, Representative Reckitt. I'd also just like to touch upon the repeal of the Affordable Care Act. Trump is aimed to have the entire ACA struck down, which would bring us to the days when insurers could charge women more and not cover maternity care. The Trump administration is set to repeal the ACA in a number of ways. And the most recent attempt was because of a lawsuit by the Republicans' 2017 tax bill. If the lawsuit is successful in eliminating the ACA, nearly 100,000 Mainers could lose their coverage, which would almost double the uninsured rate in Maine. Tens of thousands of Maine women would be stripped of health care coverage, and we'd be brought back to a time when being a woman itself was considered a pre-existing condition. There'd be healthcare discrimination. Repealing the ACA would remove protections based on gender, which would lead to higher health premiums for women. It would also allow for healthcare discrimination against people with pre-existing conditions, as Senator Breen said, such as pregnancy and rape. Women are more likely than men to have a pre-existing condition, and that can include a history of rape, domestic violence, pregnancy, substance abuse, which hits women harder than it does men. Also, repealing the Affordable Care Act would remove the requirement that almost all healthcare plans must cover maternity and newborn care, which would threaten a woman's ability to buy a health plan that actually covered the medical care that they needed. And also, repealing the ACA would cut coverage for essential health benefits like ambulatory care, hospitalizations, mental health services, drug and alcohol addiction, which are disproportionately used by women. So I think, the things that we've heard today from both Senator Breen and Representative Reckitt show us that this president has made all areas of our lives dangerous. Schools, education's more dangerous. Being in school is more dangerous. Being in the judicial system is more dangerous. Being in your doctor's office is more dangerous. Being in your place of employment is more dangerous for women than it ever has been. And I'll tell you, as a woman, it's terrifying. It's baffling. It's just infuriating. And so, I think Trump can't paper over his record with women, no matter how hard he tries. His administration's been a disaster for us and dangerous for all of us.
Kathleen, if I could jump in, even
Kathleen,
trying to exercise our First Amendment rights to march for Black Lives Matter, for civil protests, for nonviolent expression of our constitutionally guaranteed free speech rights. This president is now sending in the US military to quash our free speech rights. And what's so ironic to me is that you have the far right, who's always in this cabal about how big government is going to come and take your life away and take your freedoms away and take your guns away, and that the government is the enemy. And now it's the far right and their president who's using the US military to quash our civil rights right in front of our eyes. That is horrifying. We are entering a dictatorial, authoritarian, really, really scary time.
Yeah.
the other thing I wanted to point out, Kathleen, if I could, about the ACA and its possible repeal is in the absence of a federal equal rights amendment, which we don't currently have. That was one of the industries that fought that constitutional amendment for years, because they knew that it would make disproportionate insurance rates illegal. And so that isn't an issue right now under the ACA, but it would return quickly back as an issue, as you mentioned, because there'd be no protection without an equal rights amendment federally.
And, thank you. And Senator Breen mentioned the military. We're a military family, and my husband was in combat in Afghanistan for a year. So I didn't see my husband for a year. And I don't have children. I mean, there are women who are much younger than I am with children with a lot of issues and a lot of problems with husbands in Afghanistan. And yet a friend of the president's, it seems, was paying to have Americans killed in Afghanistan. And that, as a woman, I mean, that hurts also our abilities to take care of our families, thinking about the sacrifices that we make, which are difficult enough. But again, to be endangered, to have your life endangered by a president. And the possibility of these young women who are widowed or have husbands come home missing 3 limbs. I've seen them in Walter Reed Hospital day after day. So it's a dangerous administration and a dangerous time in our country, hopefully to be brought short, because Maine women are waiting to vote this president out in November enthusiastically. Senator Breen or Representative Reckitt, do you have anything else you'd like to add?
I just want to thank the Maine Democratic Party for putting this event together. I feel so strongly that we in the legislature have our hands full with protecting Maine women from the federal government and everything that Trump and the hard right Republicans are trying to do. So I feel really fortunate to serve with people like Representative Reckitt and to serve in the Maine Senate. And I assure you, I will be keeping up this fight every day. And that I wake up and go to bed every day thinking about what can Maine legislators do to protect Maine women, their economic security, their health, their education, their families, their salaries, their health benefits, their assets, all that they have worked so hard to accumulate, protect it from what I consider to be an onerous and frightening federal government today.
Thanks. Representative Reckitt?
To the extent we're able to do that, it's in large part because we have, in fact, a Democratic majority in the House of Representatives, in the Senate, and in the governor's seat, because that allows us to do a lot of the things that we are all looking at as protective and helpful to women and families in the state. And without those majorities, we couldn't do that. So the last thing I want to say is I understand that absentee ballots are going to be available in about 2 weeks. So unless you got some debating to do about your choices in November, you could vote right away and get that out of the way. And the plus I've always tried to sell people on is the minute you do that, then people stop calling you on the telephone about the election. So really, you're doing it for yourself as well as just getting this duty out of the way. So please get an absentee ballot as soon as you can.
Thank you. I want to thank both of these incredible women for joining me today, Senator Cathy Breen and Representative Lois Reckitt. Your careers and work in the Maine legislature on behalf of women and all Maine people are inspiring. It's good to know that even when our president holds such contempt for women and the issues that affect us, we have such strong, capable women leaders here in Maine who are doing that work every day. This ends our roundtable today. Thank you both so much for joining, and thank you to everyone who's watching from home. Visit mainedems.org/volunteer to sign up and volunteer to help us defeat Donald Trump this November. Stay safe. Thank you.
Thank you.
Thank you.
Thank you.